Can rebounding help lower your blood pressure? Clients have told me, yes, I don't have a blood pressure issue. Many women in the menopause have a blood pressure, cholesterol, cortisol, insulin resistance issue going on. And they're all about lifestyle choices, and they're all about exercise and diet and water intake and hormones changing in the body and circumstances and stress happening. So that needs a rounded and grounded approach to it. But in this post, I'm only talking about rebounding, and rebounding specifically as a form of exercise to help you lower your blood pressure. Not only that, but to tone the muscles, to help get the connective tissue that little bit stronger in your body, which eventually will allow you to do more in the rebounder. You see, many women, as soon as menopause hits, estrogen levels lower in the body, progesterone levels lower in the body, and everything gets softer. Blood vessels get softer, hence blood pressure goes up. Sugar, our ability to deal with processed sugar, gets less and less. The poor liver's under enough pressure trying to cope with the hormones that it's not doing as an effective a job. Neither is the pancreas. And so our ability to cope with the sugar gets worse and worse. And when sugar hits oxygen in the arteries, that's what causes hardening of the arteries, and hence blood pressure, cholesterol, everything going on. The solution is not just rebounding. Of course, it's going to be rounded and grounded. You need a series of lifestyle choices that need to be made every single day around drinking good water, around watching the coffee, watching the processed sugar, getting out for your exercise, getting on a rebounder, positive thinking, what you eat, nutritional support that you take, making sure you are getting the fatty oils that you need, but that they're good quality oils. And then your stress levels. That's about the tapping. And if you go through the post that I've done this month of April around blood pressure and different things that can help with it, you'll get some more advice there. But here today, Stephen Blair, many years ago, did research of a large group of people, male, female, different age groups, over a prolonged period of time. And what he discovered was those who exercise, and he placed exercise into three categories: category 1, category 2, category 3. People in category 1 did prolong their life, but not as much as people who exercised in the category 2, which is just moderate forms of exercise, and then people in category 3. Moderate forms of exercise. Albert Carter says because rebounding is 68% more effective than jogging, it's a moderate form of exercise. It will help you improve your mortality rate. So you will decrease that. You will live longer. You will feel better when you rebound. Now, he says you only need 5 minutes. And of those 5 minutes, one of them needs to be fast and furious. Many people who follow my programs and who follow me can't do that fast and furious. They can do, say, the Rebound for Wellness program, which gets you up to a moderate level of exercise. And the whole idea of the Rebound for Wellness program is do less, but do more of it. Because rebounding is 68% more effective. 20 minutes max a day on a rebounder is ample. That's it. You don't have to go as far as that. I have a woman who started rebounding at 69, and she did the 20 minutes. Then she did 2 programs, followed the first program, built up from 1 minute up to 20. Second program, the intermediate, 1 minute, 15 minutes, then introducing the new way in with that, and again up to a max of 20. And now at 75, she is combining those 2 programs and rebounding for 10 minutes twice a day. And the intermediate program would be moderate exercise on the rebounder. Okay, the basic program brings you from easy into moderate. By the time you get up to the 20 minutes, you are, and you see, it's your gravity force that does it. So look at me right now. That's the basic, okay? And you can go slow on that. But even this is causing your whole lymphatic system to move. And if your whole lymphatic system is moving, then your whole circulatory system is moving, then your whole cells are moving, and that is enough. Especially you've got leaky bladder and other issues. And if your connective tissue is very soft, you don't want aggressive exercise because you can cause concussion or prolapse on any form of exercise. So this can help you get there slowly but surely. Check out the Rebound for Wellness programs if you haven't done already. Tell your friends about it. It is, to me, the best kept secret. Now, the rebounder I use and recommend at the minute is expensive, but it's a really good rebounder, good quality. And very soon in the room has arrived a cheaper rebounder, not from the same people that make this rebounder. And I am going to review it and tell you what I think about it and whether I think it's an option. But what I'm really going to say, I know from right now, is that this rebounder will do much better and last much longer than a cheaper version. But if all you can afford is a cheaper version, it will do for now. So I follow my social media to find out about those comparisons. I might even do a post about it. Other than that, yes, rebounding, even gentle rebounding, will help you lower your blood pressure. You need to keep it up though. You need to be at it twice a day and build up from 1 minute to 10 minutes twice a day, and then see where your blood pressure is at. You got to also look at lifestyle. You got to look at diet, just like all the 10 things that were mentioned in the first post that I did on blood pressure. Happy days. Get doing the things that will help you live your best life, even at this stage in our lives, because we deserve it. We've worked hard enough. It's time to enjoy it. Thanks for watching. Like, share, and post. And don't forget, rebounding works.